Today we're going to be talking about anti-diabetic medications. So there are different types of drugs you can use for diabetes. One of them is insulin, then you have oral anti-diabetics, you have non-insulin injectable anti-diabetics, hyperglycemic agents, and thyroid drugs. So let's talk about insulin first. Insulin is split up into 4 different kinds of insulin: rapid-acting, short-acting, intermediate-acting, and long-acting. Rapid-acting insulin, also called lispro-insulin, has an onset of 10 to 30 minutes with a duration of 3 to 5 hours. Short-acting insulin, also known as regular insulin, has an onset of 30 minutes with a duration of about 8 hours. Intermediate-acting insulin, also called lispro-insulin, NPH, has an onset of 90 minutes and a duration of about 10 to 24 hours. And lastly, long-acting insulin, also known as insulin glargine, has an onset of 1 to 6 hours and a duration of 24 hours. Now, insulin can be administered in a combination in order to achieve the desired outcomes for specific patients or by itself. And so on the right here, you see we have a table that talks about the different types of insulin and how their intensity compares to their duration in hours. And what do we use these insulins for? Well, again, it's to treat diabetes mellitus type 1 and type 2. And how this insulin works is that when it's injected, it allows glucose to be taken from the bloodstream and into the cells that need it for cellular processes and regulating fat metabolism. Now, the next medication we're going to talk about is oral antidiabetics. Now, this can only be used for type 2 diabetes patients who have a functioning pancreas or that are pre-diabetic. And what does this drug do? Well, it stimulates the secretion of insulin from the pancreas. And some of these drugs include sulfonylureas, biguanides, glipitins, alpha-glucosidase inhibitors, and others. And there are some safety concerns we need to worry about as well. If there's hypoglycemia, that is a problem because if too much insulin is released from the oral antidiabetics that we took, the blood glucose will drop, causing a person to be sweaty, maybe lose consciousness, and even can lead to hypokalemia, which is a decrease of potassium in the blood. Now, there are also some therapeutic considerations we should look out for. We should first assess the patient for signs of hypoglycemia, and that actually is right after we would administer the oral antidiabetic. And signs for hypoglycemia include fatigue, hunger, and diaphoresis. We also want to educate our patient on administration. So we want them to take it 30 minutes before meals in order to have the best efficacy and safe process. Now, the next medication we're going to talk about is non-insulin injectable antidiabetics. And we use those to treat type 2 diabetes. Their mode of action is to stimulate the pancreas in order to produce insulin, which will then lower glucose in the blood. And also it will slow down the speed that the food goes through the stomach. So it will slow down peristalsis. Now, we have to be careful when administering this medication because it can cause hypoglycemia or can cause malnutrition due to a decreased appetite. Types of non-insulin injectable antidiabetics include amylin mimetics and incretin mimetics. These mimic the effects and actions of hormones to decrease secretion of glucagon in the body. And there are also some therapeutic considerations we should look out for. So we want to assess the patient again for signs of hypoglycemia after we've given them this medication. We also want to monitor their blood glucose and if they're experiencing any weight loss. We also want to educate our patient on the importance of following the provider's orders for the frequency, so when and how often to take the medication, and also what they can do in case of hypoglycemia in order to prevent it or treat it if they are experiencing it. Another medication we have is also called a hyperglycemic agent, and we use these to provide emergency treatment to patients who are experiencing severe hypoglycemia. So their blood glucose is very, very low, and this agent will increase the blood glucose levels by increasing the breakdown of glycogen into glucose. The main medication for this is just glucagon, and it's very helpful to maintain the blood sugar and pull it back up, but also we have to monitor clients for nausea, vomiting, if they are experiencing this kind of event, side effect of nausea and vomiting, we want to make sure to turn them on their left side following the administration to reduce risk of aspiration. And we want to be careful in using this medication with clients who have been diagnosed previously with cardiovascular diseases. We can administer this subcutaneously, intramuscularly, or via IV, depending on the provider's orders. And we also want to provide oral glucose as soon as possible so the client regains their full consciousness. Now, exactly how hyperglycemic agent glucagon works is by increasing the production of adenylate cyclase, which then causes a conversion of ATP to CAMP. This activates phospholipase, which promotes the breakdown of glycogen into glucose in the liver, and this results in an increase in glucose in the blood. Another therapeutic consideration I wanted to mention is we also need to educate our patients on how to monitor their own blood glucose levels so they can prevent hypoglycemia from occurring, or they can treat it immediately if they're experiencing it. There are also some safety concerns, so we want to rouse the patient immediately if there's a reduce or change in the cerebral damage from hypoglycemia. We also want to see if they're having any nausea or vomiting, and if so, like I said before, you turn them on their side to reduce aspiration risks. Now we're going to move on to 2 medications people can use for thyroid disorders. So there are 2 medications that we'll talk about, and first I want to start off with talking about levothyroxine. And we use this to treat hypothyroidism, where the body is not producing enough T4. And this can be due to damage of the thyroid insufficiency, or some hormonal problem. Mode of action of levothyroxine is that it acts as a replacement for T4, typically produced by the thyroid gland, and will be converted to T3, which will then convert to iodine. There are some safety considerations when using this medication. We want to look out for hyperthyroidism, which can cause diarrhea, chest pain, heat intolerance, weight loss, etc. And we also want to look out for arrhythmias and palpitations. We want to make sure to educate our patients to take this medication on an empty stomach first thing in the morning. And also we want to let them know that this therapy is lifelong. And once they start it, they need to continue on this medication. While they're taking this medication, we want to monitor vital signs and take regular checks of T4 and thyroid stimulating hormones to make sure it's in the expected range. Now, we don't want to give this medication to someone who has a heart attack or has had a heart attack, palpitations, or hypertension, as this could cause negative side effects. All right, the last medication we're going to talk about in relation to the thyroid is thionamides, also called PTU. And what this drug does is an anti-thyroid agent that inhibits thyroid hormone synthesis, blocking the conversion of T4 to T3. And it does this because we want to treat hyperthyroidism. So if someone is secreting too much T4 or the body is creating too much thyroid hormone, we want this medication to decrease it in order to eliminate conditions such as Graves' disease or thyrotoxicosis. There are some therapeutic considerations such as testing thyroid levels, checking for hepatic impairment such as AST, ALT levels. We want to check complete blood count, as well as we want to make sure our patient isn't pregnant because this has teratogenic effects. We want to educate our patients to notify the provider if they experience symptoms of overmedication or hypothyroidism. There are also some safety concerns with this medication, and that includes hepatotoxicity, so toxicity to the liver, rash, fever, nausea, vomiting, agranulocytosis, or thrombocytopenia, and also aplastic anemia. So if a patient, let's say, is starting to get a sore throat or a fever, we want them to contact the healthcare provider because this drug can cause immunosuppression. We want to see if there are any signs of that. Also, we want to educate our clients to not stop this medication abruptly. We want to taper off slowly to have the best effects. And that is it for anti-diabetic medication and thyroid drugs. Thank you all so much for listening.